The Lancet Commission on Planetary Health really has an ambitious vision. It looks at the range of environmental factors that are affecting our planet and how they will impact and are impacting on human health. It acknowledges that many of the driving forces of environmental change, such as energy use, such as the exploitation of water resources, can themselves have implications for health. Crucially, I think, for the first time, it tries to articulate the way in which human health is intrinsically linked to the health of natural systems. And in developing this concept of planetary health, reinforces the fact that ultimately all human society and progress is dependent on these natural systems that sustain life on our planet. 2015 is a crucial year for international development, and the Sustainable Development Goals embody many of the features of planetary health. We believe that planetary health, with its emphasis on both protecting and promoting health and preserving natural systems, can prove to be an organizing framework for the post-2015 development agenda. Can I start really by repeating and endorsing some of the thanks we've already heard to my fellow commissioners, to Dr. Rodin for her leadership and the tremendous support we've received from the Rockefeller Foundation, Fred Boltz and others. Also a particular thanks to Sarah Whitney, who was our researcher. She did the work of two people. Without her, we could not have delivered this report in the timescale we have. We acknowledge previous work, of course. I won't read them all out, but there have been a number of really sentinel reports in the past which have influenced our thinking. So one of the first facts that really struck us when we started to look at this whole area was the extraordinary advances in human well-being. You can see the population has grown, 7 billion more people on this planet. Poverty has fallen, absolute poverty, still big inequalities, sometimes increasing, but absolute poverty has declined dramatically. Life expectancy has gone up. But at the same time, we've exploited the planet's resources in order to do that. You can see water and energy use have escalated very rapidly. Domesticated land has gone up, but is now tapered off because we've exploited most of the land that is available to grow food, of course, and sometimes provide energy. We've deforested a lot of the tropical regions. There are profound water shortages which have escalated, including extreme shortages in many countries. The oceans have become more acid, and that will have effects that we still don't understand on the marine ecosystems. And of course, temperature change, unparalleled changes, 0.85 degrees since 1850 or so, accompanied by a rise in greenhouse gas emissions, higher levels than have been experienced in the last 800,000 years for many of them. Declines in biodiversity, 100-fold or more compared with the historical records. So these are dramatic changes. And the concern that we had looking at this data was that we may have mortgaged the future in attaining our current level of health and development, and also prejudiced the current advances in health. And as Richard said, we often don't take into account the prospects for sustainability when considering global health. So all these dramatic changes have led to the suggestion that we are now in a new geological epoch, the Anthropocene. This is a phrase that was coined by the Dutch Nobel laureate Paul Crutzen. And I think an increasing number of people are accepting that the dominant force now in the global environment is us, humanity. We are accelerating changes. And you can see that in the long run of history, this is a tiny epoch where humanity has been around. Holocene period, during which we've flourished as a species, only the last 11,000 years or so. The Anthropocene, we can debate where it started, perhaps in the 1950s, perhaps earlier. But there's no doubt that we are radically transforming the Earth's environment. There's this theory about planetary boundaries advanced by Johan Rockström and Stefan and others. And this is their most recent update of that concept. And what they suggest is that there's a kind of safe boundaries within which humanity can flourish. And once we start to breach those boundaries, then we are moving into more risky and more hazardous areas with the potential for non-linear and abrupt changes in the environment. And this slide just illustrates some of those. You can see that for biosphere integrity, particularly for biological diversity, we seem to have breached that boundary.
Climate change, we're in the kind of amber zone where things are changing very rapidly, and we look as though we may not be able to keep things within 2 degrees. Land use change, radical changes in land use, particularly for food. And of course, biogeochemical flows, phosphorus and nitrogen, which is causing eutrophication of water, in other words, anoxic water courses of the coasts and fresh water, which results in radical changes in ecosystems. Some of the others not so well defined, a lot of work needed to define some of the others. So what about the environmental impact of nations? Well, of course, it's quite diverse, and this map just summarizes the sort of highly complex, really, piece of data. It's a combination, really, of ranks for a whole range of different environmental changes, forest loss, habitat conversion, and so on. I won't read them all out, they're listed on the slide. And it's just to give you a kind of snapshot, really, of the kind of impacts that different nations are making on the environment. And you can see that, obviously, some of the poor African nations are making much less of an impact. Those of us in the industrialized world are making a greater impact. But there is a lot of diversity, so different countries are affecting different environmental factors according to their geographical location, their topography, their natural ecosystems, and so on. But overall, you can see that a high proportion of the world's civilization is actually having a large environmental impact. And of course, as emerging economies develop, then they are having a greater impact. So as you've already heard, planetary health starts from a slightly different position to this traditional global health agenda. Because what planetary health says is we need to pay attention to these natural systems on which our human health and development is founded. And most concepts of health do not do that. They just assume that any benefit in health is good and it can be sustained indefinitely. And our contention is that that may not be possible unless we radically change the way we develop. So what are the links with health? Well, very briefly, there are the direct effects that we're all familiar with. There's temperature extremes, for example, exposure to pollutants. Then there's ecosystem-mediated effects, altered infectious disease risk, reduced food yields, altered nutrient quality. And then these indirect, deferred, and displaced health effects, which are difficult to quantify, but arguably in the long run may be the most important. So the effects on displacement, on conflict, our capacity to adapt or not, and the consequences of livelihood loss. We tend to assume that poverty is just going to get better, but it may not if we degrade the environment and people are less able to use and develop their livelihoods. So this is a slide taken from Sam Myers' work and colleagues. And what this shows us is how populations can go through an ecological transition where through improved engineered infrastructure and access to markets, they can lead to improved health status. But if you can't get access to markets and you degrade natural systems, then you may drive more people into poverty. So this environmental change can increase inequities. And of course, there's nothing to guarantee that those people in the wealthy and middle strands there may not ultimately decline as the environment degrades further. Risk to humanity is really composed of the hazards to which people are exposed, the degree to which they're exposed, and their vulnerability. And in the report, we outline a number of factors that are related to vulnerability. So, for example, children are more vulnerable to undernutrition, for example, stunting and so on. Older people, more vulnerable to heat waves. People with HIV/AIDS are more vulnerable to undernutrition because of their increased nutritional requirements when they get HIV/AIDS. And so we articulate the different ways in which different health and socioeconomic factors increase vulnerability. So one of the things that really concerned us, and has not been looked at enough, is the effects of multiple environmental factors. Most people have looked at one factor in isolation. They look at climate change or they look at biodiversity loss. What they don't do is to try and put things together. And that was a major concern. We couldn't find a lot of empirical evidence, but we were concerned about the potential for negative and synergistic interactions. And we have here a list of factors affecting the food and agricultural system. You can see it's really quite impressive. Everything from land degradation and soil erosion, perhaps causing loss of 1 to 2 million hectares a year, or perhaps more. Water scarcity. We're going to hear from Sam about the loss of pollinators and the effect that that could have on health later on. We've heard already about fishing and climate change, of course, and CO2, fertilization, and other factors have marked effect on food and agricultural systems. So we need to understand better how these factors can act in concert And the other worrying thing is that most of them are negative. I mean, you might get some improvements in the northern latitudes short term, but overall, these factors are all going to be negative. The other thing that's striking is that many of the risk factors for the chronic disease burden that every society in the world is increasingly facing, even poor countries are facing increasingly, many of them are related to diet and to the environment. And this slide just shows you it's adapted from the papers in the Lancet by Lim et al. On the global burden of disease. And you can see these kind of reddish bars are the dietary-related factors. Now that's important because diet, both our dietary choices drive environmental change, so the kind of food choices we all have and the demand for animal products drives environmental change, drives land use change, greenhouse gas emissions. At the same time, of course, they are responsive to environmental change. So as we'll hear later from Sam, some of these changes, like pollinators' loss, could affect fruit and vegetable production, for example, as indeed could climate change. And that will have an effect on our risk of heart disease and many other chronic diseases. And then many of these other major factors in a sort of greenish color are also related to the environment. So on balance, many of the factors that are driving NCD risk are related to environmental and dietary exposures. This slide just shows you, it's just an example really, from a study in PNAS last year, just looking at the effect of water and climate together. This particular slide shows you the potential change in crop production from the maximal use of available water on rain-fed and irrigated areas. And you can see the reddish is where you're going to get declines, likely declines in agricultural production. So that will be over and above the direct effects of climate change. And what you can see is there are some countries where you get a green pattern, so maybe an increase, but it's going to be very difficult to balance the two because these are uncertain, and many of these countries in the band in the middle suffer traditionally from drought and from under precipitation. So it's going to exacerbate a situation which is already quite serious, and many of these countries also struggling at present time to satisfy their nutritional and other requirements. So that's just one example. Air pollution is a well-known risk factor. We don't discuss in detail the links with fossil fuel combustion because the Lancet Commission on Climate Change, reported just a few weeks ago, did that in some detail. We do point out the importance of household exposure. 4.3 million deaths a year, mainly women and children, from the combustion of solid fuels. So providing clean household energy is a crucial intervention for public health, but also can help to prevent environmental degradation, because some of this results in deforestation, but also some of the pollutants, particularly black carbon, also have environmental effects. Tropospheric ozone has effects on human health, but also has effects on natural systems and on crop yields. So again, important linkages there. We also draw attention to the importance of land use fires, landscape fires. They kill about 300,000 people a year, but they're also important because they're driving biodiversity loss. So people clearing land to plant palm oil or whatever. And we know in many parts of the world, this is a major health problem. In Asia, for example, work done by HEAL shows that you could reduce smoke exposure in parts of Asia by perhaps 80% by stopping the burning of Indonesian peatlands. Water-related illness is a really important issue still. We've seen improvements in water and sanitation, but 2.4 billion people still use unimproved sanitation facilities and are vulnerable to water-related diseases. And inadequate water and sanitation is responsible for about 700,000 deaths, and diarrheal disease likely to increase. We also outline the importance of schistosomiasis and the potential environmental factors to infect the spread of schistosomiasis, as outlined on this slide. And that's also important because it's a risk factor for the transmission of HIV/AIDS. We use the example of Pakistan as really a kind of case study of the potential for disasters, many of them linked to environmental change, to affect the whole health and well-being and development of a whole country. And Pakistan suffers from a multiplicity of problems: dramatic population growth, one of the highest outside sub-Saharan Africa, recurring floods and droughts, some of which is due to natural variation, a decline in the flow of the Indus River, for example, which of course is very important for an agricultural country, and overexploitation of groundwater, so that by 2020, 2025, demands will probably exceed available water. And then in the last couple of weeks, we've seen deaths from extreme heat, 1,200, that's probably an underestimate, bound to be an underestimate. But you can see this dramatic map of the temperature in parts of Pakistan. So this combination of factors leads us to be really concerned about the future of a country like Pakistan, and this combination of population growth and environmental stress could lead to increased conflict and social stresses. Emerging diseases, quite a major theme. This is taken from the Eco-Health Alliance publication, but shows you the range of emerging diseases which have arisen over the last couple of decades, many of them related to changes in food system, agricultural systems, and occurring in areas where there's environmental disruption, which brings infectious agents in contact with human populations. And we have a case study by Steve Osofsky on Ebola, which we can talk about later in the panel discussion if we have time. So this just gives you an indication of some of these emerging diseases, many of which are related to some of these changes. So I've outlined some of the problems, but we want to move on to this in the second half to some potential solutions. There's no point in just bemoaning how bad the situation is. We need to come up with strategies that will help us to resolve some of these challenges. We outline a number of challenges in the report. Conceptual challenges like an overdependence on GDP to measure human progress, knowledge and information challenges like a lack of good research, lack of good evidence, and also governance challenges. And the fact that at the moment we still don't have systems to take into account the value of natural systems and to integrate them into public policy. But I'm going to focus very quickly in the latter part of my talk just on a few concrete and very specific policy recommendations that we can debate. The first of these is sustainable and healthy cities. And we're going to hear, I think, from Dr. Bassett later on about the role of New York in taking some of this agenda forward. But there are a number of reasons or a number of linkages between cities and sustainability. The growth in urban populations, most of the growth around the world will be urban, not rural. So there are some cities that haven't yet been built. We have an opportunity to build them better than current cities. And there are cities that can be retrofitted to make them more livable and more sustainable. Active travel, public transport, for example, reduce emissions, reduce energy use, reduced fine particulate air pollution. Green spaces, there's a lot of evidence and interest now in the positive health benefits of green spaces. Increased biodiversity, reduced urban heat island, mental health benefits. Watershed conservation, providing clean water for cities. Access to healthy, low environmental impact food, including allotments, increasingly food grown within urban areas, and increased resilience to floods, storms, and droughts, as exemplified by some of the work going on here at the Rockefeller Foundation through the pioneering work of the 100 Resilient Cities initiative. Restoring ecosystems can play an essential role in regulating freshwater quantity and quality, and about a third of the world's largest cities source their clean water from protected areas. So you can see that nature, protecting nature, can be vital to ensuring clean water for these cities. There are major challenges in addressing increased food requirements, and this slide just shows you the blue line is the historical line, and this slide shows you how we're going to have to accelerate efforts if we're going to actually provide food for a growing world population. That's not just due to population growth, but also because of dietary demands. So as people develop, they want to eat more animal products, and animal products have bigger environmental footprints, partly because of conversion inefficiency and other factors as well. So here are some of there's no single answer, there's no magic bullet. There are a whole range of strategies, some of which are listed here, and all of them need to be explored and evaluated with regard to their impact on health and the environment. We think many of these are very positive and very promising. Let me just touch on one or two of them. Reducing food waste. This is something that really struck me. I hadn't realized how much food globally was being wasted. About 30% of the world's agricultural land is producing food that's never eaten. Sometimes it's discarded. It's perfectly healthy, some of it. It's just discarded because it doesn't look right. And so the supermarkets won't buy it. In Africa, aflatoxin is a problem. This is a fungal toxin. It causes major health effects of cancer, increases the risk of cancer, and also property stunting. And there are new technologies through non-toxic approaches that replace the toxic fungus with a less toxic fungus. So there's a lot that can be done to reduce food spoilage and food wastage. A lot of work going on, which we summarize on low environmental impact and healthy diets. And what we show is that you can have a healthy diet with somewhat lower animal product consumption that will give you, and also importantly, increased fruit and vegetable consumption, seeds and nuts, which are beneficial, which will give you improved health at a lower environmental impact, lower land use, lower greenhouse gas emissions. So getting that dietary balance right could have a really important effect. And we've estimated in the UK, for example, just through promoting a diet which adheres to WHO recommendations and minimizing the deviation from our current diet, we could reduce emissions by up to 40%, something like that, as well as improving health quite substantially. We also, I think, were convinced that aquaculture is going to play a very important role in future demands for food. The wild capture fisheries, as you can see here, are sort of tapering off, probably going down. Aquaculture is making up the gap. The problem with the aquaculture is it's not sustainable. A lot of it is fed, it's using other fish to feed fish, high use of antibiotics and pesticides and so on. So moving towards a more sustainable aquaculture can help us to address nutritional requirements. About 2.9 billion people get 20% of their protein or so from fish. And also some of the nutrients like omega-3 fatty acids, for example, that can prevent heart disease, can arise from fish consumption. So we believe that sustainable aquaculture and research on that, linking it with environment and human health, is going to be crucial. We also document emerging evidence of how conserving natural systems can help reduce disease risks. And this is based on the work of one of the commissioners, Subrendra Patanayak, in the Brazilian Amazon. Just one example of one of his conclusions, showing how forest conservation can reduce disease risk. So reduce malaria, acute respiratory infections due to reduced air pollution, and diarrheal disease. And so there's growing evidence, really, that forest certification can actually benefit the environment and benefit human health. We also acknowledge the importance of ecosystems to strategies to increase disaster resilience, and these are often no-regret strategies. So strengthening, supporting, rejuvenating, rehabilitating wetlands, mangroves, and coral reefs can help protect coastlines at a much lower cost than engineered solutions, and also provide environmental benefits and economic benefits too. We document the need for resilient health systems based on some of the work that's been undergone here in the Rockefeller Foundation, showing that we need more resilient health systems to tackle some of these shocks that will occur and are occurring. So they need to be adaptive, diverse, self-regulating, integrated, and they need to detect health threats before they really strike. And we give some examples of programs in countries that are beginning to develop a workforce which can create a more resilient system which will achieve universal health coverage as well as tackling some of these environmental issues. Then it's already been said that we're in a crucial year because we're moving into the post-2015 development agenda, moving away from the Millennium Development Goals, which have guided development over the last 15 years or so, towards a much more all-encompassing agenda, which will encompass countries at all levels of development. These are the Sustainable Development Goals that I thought, or we thought as a Commission, were most relevant to planetary health. And what's interesting, there are 17 goals altogether, quite wide-ranging, maybe ambitious. Some people have said too ambitious. But they do embrace many of the elements of planetary health about reducing poverty, reducing inequalities, achieving food security, ensuring healthy lives, water sanitation, sustainable consumption, urban centres, biodiversity, and so on. One of the criticisms have been is that the SDGs are ambitious, but they're not coherent enough. They don't tell us actually what the overall vision is. And what we argue in our paper is that planetary health can provide that organising framework which emphasises the need to set human development and health within the confines of the finite boundaries that nature has provided for us, and to harness our skills, our technologies, in order to achieve those goals. So we believe it's highly relevant to that agenda. And then the other thing that was quite striking, I think, to those of us looking at the evidence was the fact that we are subsidizing, to some extent, our own undermining the environmental boundaries. And what's extraordinary is just the amount of subsidies in the system. I mean, it's water, food subsidies, agricultural subsidies, fisheries subsidies. The most dramatic one, of course, is energy subsidies, fossil fuel. And this is $5 trillion, according to the recent IMF report. Probably 5 times as much as money we need to transform the world economy into a low-carbon economy. And almost probably about almost as much as we spend on healthcare around the world. So it's really a dramatic subsidies. And many of these are due to the fact that we don't take into account the externalities, the damage that we're actually doing through burning fossil fuels and some of these other environmental trends. And you can see how these subsidies are based around the world. So we argue that reforming taxes and subsidies for planetary health will be a really important part. Obviously, subsidies are not always bad, so one has to be careful about ensuring that the poor don't suffer. But addressing harmful subsidies is a really important part of the whole strategy. And then finally, we briefly touch on the issue of economic development. And we pick up the idea that we need to move more towards a circular economy, where we reduce waste, we increase recycling, remanufacturing. We use our limited resources much more efficiently to produce the kind of levels of human development to which everyone on the planet aspires. And in doing that, as long as we adhere to good occupational health standards, then we believe that we can improve health, maintain the pace of development, but also help to bring us back within some of these environmental limits. And finally, one can't stop without mentioning population. It's very clear when you look at the data, population is very important. I mean, there could be more than 10 billion. Some estimates suggest over 12 billion people by the end of the century. And there's a big human rights issue here. Around 225 million lack access to effective contraceptives, and which they want to be taking. So access to family planning could also have near-term co-benefits, could reduce maternal deaths and help us to achieve some of the development goals we want now. So meeting the needs for modern contraception would only cost, in international development terms, a small amount of money, and we should be paying more emphasis. So population is really important, but let us be clear. We're not going to address this planetary health agenda unless we also address the underlying resource issues, because it is the resource intense world economy that is playing a very major role in driving us towards this unsustainable future. So in conclusion, the solutions do lie within reach. There are many potential solutions. They should be based particularly on an emphasis on health, prosperity, human development in the international development agenda. Focus on enhancing the quality of life, obviously delivering improved health for all, together with respect for the integrity of natural systems on which ultimately our health and development depends. So as I've said, we really need to address both our drivers, the drivers of environmental change, as well as population growth, and harness the powers of new technology for change. So there are many opportunities for the private sector, for the public sector in this agenda. And I think we can help to tease out some of these solutions, some of these opportunities in the panel discussions that will follow. Thank you very much indeed.